this is NUR 236, skill number 3, airway management, tracheostomy, and suctioning. The first thing we want to do is, if we're going to suction our patient, usually they're unconscious when we do nasotracheal and nasopharyngeal suctioning. We want to have them upright. Apply clean gloves. We could wear mask, goggles, and a shield and gown if we thought it was going to get on our clothing. We want to turn our suction on to continuous suction. We want to test it, put our thumb over it, and it works great. Typically, you're going to turn it on to high. You want to hyperoxygenate your patient prior to this. If they require it, you're going to explain to your patient what you're doing the whole time. So, Mr. Monroe, we're going to do some suctioning care. And when you get your kit, it has tracheostomy and suctioning, so you're going to use it for both. You get one kit to practice with. There'll be sterile water out. We check the expiration date. We're going to open it. We're going to put the label in our hand. Then open it all the way. And we're going to put it. Okay. Oh, I wanted to leave that off. All of it. Okay. And move one of these out of the way. So you're going to come over here and open your suction kit. You can leave the label on because then you can just cover it up and write your name. You also need a towel that I didn't grab, but we'll just put this towel over him. So we're going to put a towel across him. Luckily, this patient's not doing so hot. He also has a trach, so you could suction his trach if needed. You're going to remove your clean gloves. Before I put on my sterile gloves, I'm going to pour water into this little container right here because I'm just using the suction part of it. I'm going to open up your sterile gloves. When you suction, you only want to suction twice and wait 1 minute in between. There's glove number 1. I'm just putting my fingers on the glove so I didn't touch it when I was trying to lift it. There's glove number 2. Then you're going to have a sterile hand and a non-sterile hand. So right now they're both sterile, so I'm going to take this catheter tubing and put it in my hand and stick this out. You can lubricate the end of this with lubricant or sterile water. I kind of touched that. Okay, and then you're going to take this and you're going to push this into here. You can also test your suctioning. Oh, it's slurping up water. Okay. So, you're going to tell Mr. Monroe, I'm going to suction you. If your patient was alert and oriented and talking, they wouldn't tolerate this, so typically they're unresponsive. So you're going to insert into the nair. Well, I'm going to try this other nair. Mr. Monroe. There we go. You shouldn't meet that much resistance. And you're going to insert it approximately 16 centimeters to do nasopharyngeal suctioning. If you're going to do nasotracheal, you're going to do 16 to 20. When you're in, you're going to go up and down on the green, and you're going to turn this in a circular motion, nice and slowly, within 10 to 10 seconds. Okay? You're going to have a whole bunch of lubricant in here. It's going to slurp it up. Hold your suction down so it moves through there. And then you're going to do it again. You're going to wait a full minute in between passes. Reapply as oxygen if needed. Mr. Monroe, I'm going to push you out. There we go. 16 centimeters. These are clearly nicely marked. You're in. You're going to go in a circular motion. And withdraw. And then you're going to test your suction, so you clean the line. You're going to chart. Once you're done, you're going to chart what you did. So you're going to say, and then you're suctioning that you nasopharyngeal suctioned him 16 centimeters using sterile technique. You can chart that you got 50 mils of green mucus out of his nasopharyngeal passage and that the patient tolerated it well. If you have any and if we were going to do nasotracheal suctioning, you are going to go to the 20 centimeter mark. And if you want to do nasotracheal and nasopharyngeal, you'd want to do nasotracheal first and then nasopharyngeal. And if you meet resistance, you need to stop and notify the healthcare provider. Thank you.